So my name is Michael Smith. I'm the Lead Associate Medical Director for Mental Health Services across the board area of Greater Glasgow and Clyde, and that covers all age groups and all care groups, including addiction services. So as a doctor, I'm a consultant psychiatrist and I work here in Paisley 1 day a week, seeing in this clinic patients really with depression and anxiety. Well, as people will know, as a result of the kind of social changes that are happening at the moment, mental health services, like people themselves, are under greater pressure. So the number of referrals to mental health services is increasing year on year, not only with older people who are needing support with things like dementia, but also in the working age population. One of the things we've been trying to do in mental health services is to move away from always just providing the standard model of care, which would be a consultant or another doctor or clinician in a clinic, but instead to really get people to the kind of thing they need as quickly as possible with a minimum of hassle. So although I am sitting in a clinic here as a doctor today, if you had depression and anxiety, there's pages you can look at on our website which might be able to help you, or you can self-refer to this service without a GP referral. And if you phone up seeking support, you'll be phoned back within a few hours by a clinician who'll spend some time with you trying to work out on the phone what will be right for you. I certainly think the biggest change in mental health over the last 40 years is a huge reduction in the number of inpatient beds that we used to have. So even 40 years ago, in the 1980s, almost all the care we provided in Glasgow and Clyde would have been based in an old psychiatric hospital. That just isn't the case anymore. Almost all those beds have gone, and instead we've tried to focus care and treatment in the community. In the past, in mental health services, people used to be quite ill before they were ready to seek treatment because it was mainly based in hospital. What we're trying to do is to make services much more accessible and community-based, and actually much more useful to people in their everyday lives. And that lets us do a couple of things. First of all, to try and prevent mental health problems from happening in the first place. And even where that's not possible, is to try and intervene so early that things don't get as bad as to need inpatient care. So one of the things that matters to us in mental health services is the whole recovery movement, and that's saying something really important, which is there's more to being well than just having fewer symptoms. So in the world of integration, where we're joined up between health and social care, there's an opportunity to do that really effectively. So often for people to live well, it's not just being on the right medicine or having the right clinicians. We'll continue to do that as before. It's also rebuilding confidence and reconnecting with social networks. And in an integrated setting, it's much easier to provide that kind of thing for people. Moving forward together for me is a couple of things. First of all, it's making sure that we're investing in the health service of the future and not the health service that we used to deliver in the past. And in particular to make sure that we've got a commitment to everybody so that they can receive all the clinical care they need, but not more than they need. So that we would try to minimise over-treatment or unnecessary appointments or admissions or that kind of thing. And part of that promise to people would also be about making sure that people can get as quickly as possible to the thing they really need with a minimum of hassle.